healthcare system in this country is grossly insufficient when it comes to the needs of stroke patients and other brain injury survivors. The good news is... Hey there, my name is Alex and I'm a clinical specialist with Motus Nova, and I work with stroke patients every day to see if using the Motus hand or the Motus foot could help improve their function. There are so many issues with our current healthcare system. However, today I'm going to touch on 3 of the most common issues that neuro-rehab patients are faced with. Neuro-rehab is a lengthy process and requires hundreds of hours of therapy to see substantial results. When a stroke patient is admitted into inpatient rehab, they typically receive between 2 and 3 hours of therapy per day. This regimen of rehab is the right approach, but all too often it is cut off before it should be. Fundamentally, the healthcare system wants a patient to be as functionally independent as possible, such as graduating from a wheelchair to a walker or from a walker to a cane. The current outpatient therapy framework for neuro-rehab patients doesn't allow for them to get the necessary hours of rehab that they did receive in inpatient rehab. Because of this, they are often told by their providers that they've had a plateau in their rehab and that they shouldn't expect to see much more recovery than they had at that point. But this is a chicken and egg issue actually, because if the healthcare system had provided these patients with more rehab, they'd likely continue to see improvements. But because these patients are cut off at a certain point post-injury, their improvements come to a screeching halt. There are numerous studies showing that stroke survivors and other brain injury patients can make functional gains past the 6 to 12 month window that they're often told about. This is contrary to the common belief that these patients have a limited time frame to continue to see improvements after their injury. Every year, more than 800,000 people in the United States will have a stroke. There's currently no infrastructure in the United States that can support this amount of stroke survivors. We just don't have enough trained healthcare providers who specialize in neuro-rehab. Not only are there a lack of providers, but there are some areas in the United States where these therapists are few and far between, which makes getting rehab even more difficult. Specifically, patients in the rural areas of the United States are really underserved. You also have to consider transportation logistics for outpatient therapy. An average health insurance program will typically cover 2 to 3 one-hour occupational and physical therapy sessions per week. As we know from clinical research, patients who suffer from a stroke or related brain injury need much more than that. Patients actually need between 1 and 2 hours per day, if not more. For those who can't afford to pay for this additional therapy, the out-of-pocket expense can be extraordinary. An additional 1 hour PT or OT session that is not covered by insurance can cost between $100 and $150 per session. In my experience talking with stroke patients and brain injury survivors, most cannot afford that. This leads to them giving up on their rehab altogether, which is not what we want. The healthcare system in this country is grossly insufficient when it comes to the needs of stroke patients and other brain injury survivors. The good news is that Motus Nova allows these patients to get in the necessary amount of rehab from home at a fraction of the cost of traditional rehab, using robotics and artificial intelligence. Getting over a plateau in your rehab may be possible when you put in the work. Of course, there are other factors to consider, like age, time since injury, and type of injury that all could affect this. However, there is a solution, and it requires you getting in more repetitions. Motus Nova allows you to get quality repetitions and hundreds of hours of therapy from the home. You can get far more repetitions and hours of rehab than you would with traditional rehab and on your own schedule. This is because there's no imposed ceiling on the amount of hours that you can get in when you're using the Motus hand and the Motus foot. So let's do a hypothetical. In this scenario, let's say your insurance program will cover 3 outpatient therapy appointments per week. But you know that you need to be doing rehab every single day, so that leaves you missing 4 therapy sessions. Typically, additional therapy sessions that are paid for out of pocket will cost between $100 and $150 per session. But let's say you found an occupational therapist who gets the job done and charges on the lower end of that, only $100 per session. Even in this ideal scenario, you're still paying $400 a week out of pocket. With the Motus hand, you can get those 7 hours of therapy per week and then some for $400 a month. Rather than relying on this dream occupational therapist, with the Motus hand or the Motus foot, you're the boss of your own rehab. You're able to split up these additional hours of therapy however you want, and you cut out the need for travel. It's clear that the US healthcare system needs drastic reformation in regard to neuro-rehab, but until that happens, robotic therapy can supplement some of these inadequacies. Motus Nova has given thousands of stroke and brain injury survivors the opportunity to get rehab in on their own terms. I'm proud to be part of a team whose main goal is to increase the quality of life for this largely underserved population.